Good morning. Thank you all for being here today. Lovely day. Today we're going to talk about the new announcement. Ensuring health and safety for our healthcare workers has been and will continue to be a fundamental priority in our response to COVID-19. Throughout this pandemic, we have relied on our occupational health and infection prevention and control experts, and their guidance and leadership has ensured healthcare workers throughout the province can apply evidence-based protocols and practices to minimize the spread of the virus among patients and themselves. This includes the point-of-care risk assessment, hand hygiene, and cleaning and disinfecting the environment and equipment. And these processes have been and will continue to be required in the care of all patients at all times in every healthcare setting. We have tested more than 6,500 healthcare workers in the past 3 months, and this includes first responders, staff working at hospitals, as well as within the community at testing sites, in the isolation centers, as well as in the community. And we are reassured by the fact that there has not been a confirmed case involving a healthcare worker in more than 2 months. Throughout this pandemic, personal protective equipment protocols have continually been adapted based on the evidence, leading practice, and local expertise to ensure that our staff remain protected. And as we continue to plan and prepare, our current supply of PPE has improved steadily in most categories, all categories, since the height of the pandemic. The global production of supplies continues to improve. Our shipment orders are arriving on time in the quantities ordered and of the quality they've been ordered in. And we are now at a point where we can systematically track the supply and demand to the point where we can also change practice and model that out to look at the long-term impacts of those changes. We are in a position now to offer enhanced access to specialized PPE for nurses and other healthcare providers from throughout the province. This policy change is a result of talks that began with the Manitoba Nurses Union, but we are extending it to all healthcare workers to ensure that providers have consistency in application and protocols. So I do want to be clear, though, that this announcement should not be misinterpreted. COVID-19 is still a threat in Manitoba. We anticipate that PPE procurement will be an ongoing challenge that will require close scrutiny in the foreseeable months. And while we continue to adopt the PPE guidelines, based on evidence and based on circumstances, we still do encourage clinical providers to embrace these changes, but also remain vigilant in their efforts to conserve PPE as much as possible. These efforts will ensure that we have enough supplies that will last us for the duration of this pandemic. So at this time, we are confident in our system's capability to provide enhanced PPE, and we will continue to evaluate the situation over the coming weeks and months ahead. And I did just want to also take this time to thank all our healthcare providers for their courage in facing this public health challenge. Your ongoing professionalism and commitment in providing excellent patient care in the face of this pandemic does not go unnoticed. Your ongoing dedication has been appreciated by all Manitobans over the last several months and will continue to be as we go forward in this unprecedented challenge. So the plan announced today will help to ensure we continue to evolve and adapt together to protect the staff of safety, patients, and visitors in the months to come. And with that, we can open the floor to any questions you may have.
Lanette, you said these efforts will ensure that we have enough supplies to last the length of the pandemic. How long are you guys preparing for? Do you have any ideas on how long this is going to stick around? We'll be prepared to be dealing with COVID-19 for a long time.
Yeah.
Could you clarify that a little bit?
Well, obviously, I don't have a date. I wish we had a vaccine, but in the meantime, we are looking at months to years potentially. Like I would say, yeah, like as long as it takes. It's going to be ongoing, but we're looking far out, and because things are changing and adapting so much as we go, we just have to be prepared for anything.
The nurses union had talked previously about their concerns with the one masks that nurses were getting per shift.
Yeah.
They've released today that there were some changes there. Could you just maybe go over some of the changes that we're seeing now?
Yeah, the changes mostly are in the areas where we have green, we call them green zones, where we have red zones for confirmed COVID cases, we have orange zones for suspected, and green zones are mostly for those safer areas where they don't appear to be symptomatic. They come in for non-COVID-like areas. So for those people working in that area, we are looking at that they can change their mask more, their procedure masks more frequently, up to twice a day per shift. So basically at meal break, instead of using the same mask for the entire shift, that they can switch that over. And we have modeled that out, and we feel confident that we have enough procedure masks to accommodate that throughout the system for all healthcare workers. The other will be related to N95s. So we have always been doing a risk assessment. We will continue to do that risk assessment, but this gives really staff the option that if they feel that if it's a AGMP and the patient or the client is at a risk because they can't control their coughing or there's other situations, then it just gives them more choice and they can choose to have an N95 mask where it's appropriate.
What kind of stockpile of PPE do we have right now?
So in all areas, masks, goggles, gloves, procedure masks, and N95, we have at least 30 days supply. In some of those, we have much more, like months to years. But the N95 is the one that we worry the most about because we've had challenges procuring that. But so far, so good. And the fact that the N95 orders are coming in, the fact that the marketplace has opened up, the fact that we can track supply and demand gives us confidence that this is the right time to make this decision.
With these changes, do you know how much quicker you'll run through PPE? Are you expecting a considerable uptick?
Well, we're going to have to see. I mean, the procedure masks we have enough PPE, so I think we're going to be fine there. But if we see some change, if we can't keep up with the usage, then we are going to have to look at what the protocols are. And we will work with the unions as partners to make sure that we are able to continue to provide services to the public and also make sure our staff are safe.
You mentioned obviously that this is confidence for you guys in the fact that you have enough PPE. Can you speak to the healthcare workers and might this improve their confidence in now having a more short situation?
Speak to the
improving confidence of maybe healthcare workers to have that extra option.
Yeah, well, I think we always wanted to make sure that they were safe. It wasn't normal operations, but it was always our top priority that they remain safe. So this is giving them more choice, and things may change if the PPE situation changes, but we want to be adaptable. We've always said we want to be able to progress and move with the flow of things. So I feel good that staff can have this more opportunity to make choices. I think working in partnership with MNU specifically, but all the unions would be, it's good to have them as partners in this, and I think they will help advocate for the nurses, and it will be helpful for them to have more transparent information and see where we're at with the supply chain, and we can make decisions together.
Now that you guys have seen how Manitoba and our hospitals have handled, our first wave here, though we don't know what the fall is going to look like or a potential second wave, how does that play into how you guys are planning for what's to come next? Obviously, you didn't have a lot of time to plan for COVID.
No.
But now that we've seen what's happened and kind of have a better understanding, how does that change how you're adapting for the next few months?
Well, we certainly, we didn't anticipate a global shortage of PPE. That was a surprise to us. So we're definitely in the planning, looking at how we can stockpile. We're working closely with government as well to make sure that the whole system, so we oversee the healthcare system, but there's justice and there's other areas that need PPE, the private practices as well. So that's a big part of what we're doing now to prepare for that. We're also really focusing on that prevention and containment. We don't want to get to the point where we have community spread and inpatient capacity is pushed. We appreciate it might come and we're getting ready for it, but really the focus has to be on that contact tracing, the isolation, and the testing.
Do you anticipate that the hotels and the isolation shelters that we have in place are those going to continue for kind of the foreseeable future? Because obviously we don't know what's going to happen.
Yeah, they absolutely are going to continue for now, and there is the potential to expand. We actually thought we would have expanded in the past, but we didn't need to, thankfully. But we do have protocols that are standardized. They can be spanned. They can go across the province, and we've already provided orientation to health system providers throughout. So if and when we need to escalate that resource, we absolutely will and can.
Do you know how much we're currently spending per month on PPE? I know early projections were $80 million a month, I believe, up to about $900 million of change in a year. Are we still on that pace? Do you know how much we've spent so far?
Well, it's a changing number depending on how much PPE and what change in practices occur, such as this. So I can double check that for you, Josh, because the numbers are changing regularly. But we can look into that. Hey, Kevin? See if we can find that for you. No, this is specifically looking at those that are working within the publicly funded health system. Private sector may want to do this. They may already be doing this, and they often have different sources of PPE than what we use in the system. So certainly we share our guidelines and our protocols broadly, and it's up to those private providers to decide how they want to apply it in their setting.
Rudy kind of touched on this, but I just want to kind of clarify. You say that you have an ample supply for the foreseeable future. Does that include the potential second wave and a potential spike later in the fall? You're accounting for that as well?
Yeah, we're working at the same time as stockpiling. So now that we have a really good picture of what's coming in and what's going out, and we have more shipment orders coming in that we can see, so we're planning ahead for that. So we are looking months ahead, and we are looking at making sure we have that stockpile available.
Clearly, the nurses union was involved in these negotiations now. How involved were they when these protocols were originally put in place a few months ago? Did they have this kind of say then? What kind of change between then and now?
Yeah, well, we certainly have been in communication with them, but things were moving quite fast, and we did not have the opportunity to sit down, and we actually probably didn't have the data available to share what we are able to share now. So that was something that was just in the moment of the crisis at the time. We did not have that opportunity, but we are very grateful to have that now.
How is our hospital situation in some of our critical care beds? Obviously, we have nobody for COVID that's in hospitals right now, but that was a concern previously about bed space and ventilators and all of these things. What's our situation like?
So right now we have about 75% occupancy in critical care. So there is capacity. If there was a surge tomorrow, we would be able to accommodate that. There also is beds available on the medicine and surgery unit. So we're about in Winnipeg 80% occupied, and in rural and northern about 70%. So there is capacity there. That is fairly typical of the summer. We know it gets a lot busier in the winter time, so we're preparing for that. And in the spring, we did purchase a lot of extra ventilators and monitors and beds, and we developed what those staffing models would look like in the event that we needed to go over capacity. So right now we are in a stable state and continue to prepare.
Besides the monitors that we sent, those extra monitors that we ordered that got sent to Quebec and Ontario, have we sent any of our other stuff elsewhere?
Not that I'm aware of, Brittany. No. Thank you.